3 years ago, a 72-year-old man sat across from me in my office. 4 different medications, every single morning, 165 over 95. His previous cardiologist had doubled the dose, twice, and nothing changed. He looked at me, this quiet, dignified man, and he said, "Doctor, am I just broken?" He wasn't broken. His thermostat was. And what I showed him that afternoon changed everything. I am going to show you the very same thing today. My name is Dr. Kevin Adewale. I am a cardiac surgeon with 30 years at the operating table. And in this video, I want to have an honest conversation with you. The kind your doctor may not have time for during a 12-minute appointment. High blood pressure is the most diagnosed condition in people over 60. More than half of you watching this right now are either on medication for it, or you know you probably should be. And here's what troubles me deeply. After 30 years of seeing patients, we have dozens of medications, we have guidelines, we have follow-up appointments, and yet, cardiovascular disease remains the #1 killer of people in this age group worldwide. Something is not adding up. So let me ask you a simple question. If your medication was truly solving the problem, why does your pressure keep coming back the moment you miss a dose? Why does it creep up again after a few months, even when you take the pills faithfully every day? Because the pills are treating a symptom, not the cause. Here is the way most people think about blood pressure. The heart pumps, the arteries carry blood. If the pressure gets too high, we slow the pump down, or we widen the pipes. That is essentially what most blood pressure medications do. And for many people, that helps. For a while. But here's what the textbooks often gloss over. Your blood pressure is not just a mechanical system. It is a managed system. There is a control center deep inside your brainstem in a region called the RVLM, the rostral ventrolateral medulla. That acts like a thermostat. It receives information, it processes it, and it decides what your pressure should be at every moment of every day. And in many people over 60, that thermostat is stuck. Not slightly off, stuck. Set too high, sending continuous signals to keep the pressure elevated, regardless of what the pills are doing downstream. That is the problem nobody is talking about. Now, why does this happen? And more importantly, what can you actually do about it? That is exactly what we are going to work through together today. Let me take you inside the brain for a moment. I promise, no medical degree required. Deep in your brainstem, there's a tiny cluster of nerve cells called the RVLM. Think of it as the command center for your entire cardiovascular system. It runs 24 hours a day, 7 days a week. It decides how fast your heart beats. It decides how tightly your blood vessels contract. It is, in every practical sense, the thermostat for your blood pressure. Now, in a healthy system, this thermostat is flexible. It turns up when you need it, when you stand up quickly, when you climb stairs, when something frightens you, and it turns back down when the danger passes. Up and down, up and down. That is normal. That is healthy. But here's what happens over time, particularly after the age of 60. The RVLM starts receiving faulty signals. Chronic stress, years of poor sleep, inflammation, metabolic changes. All of these slowly recalibrate the thermostat upward. And at some point, it stops coming back down. The command center gets stuck. It keeps firing signals to the heart and the blood vessels. Stay tight, stay elevated, stay ready. Even when there is absolutely no reason to. Even at 2 in the morning when you are sound asleep. Does that sound familiar? Have you ever checked your pressure first thing in the morning? Before coffee, before stress, before anything, and found it already high? That is your thermostat, stuck overnight. Keeping everything elevated while you slept. This is not a pump failure. This is a software problem. And you cannot fix software with a mechanical tool. Now let me tell you about the other half of this story. Because the thermostat does not work alone. Your body has its own built-in pressure monitors. They are called baroreceptors, small sensors embedded in the walls of your major arteries, particularly in the neck and the aorta. Their job is beautifully simple. Detect the pressure, send the reading up to the brainstem, let the thermostat adjust. Think of them as the thermometer on the wall. The thermostat needs accurate readings to do its job properly. If the thermometer is broken, The thermostat cannot respond correctly. And here's the problem. After 60, the walls of your arteries naturally become stiffer. You have probably heard the word arteriosclerosis, the gradual hardening of arterial walls. Most people think of this only as a heart attack risk. But there is another consequence that almost nobody talks about. When the arterial walls become stiff, the baroreceptors embedded in them become stiff too. They lose their sensitivity. They stop stretching properly in response to pressure changes, and so they send incomplete, inaccurate signals up to the brainstem. The thermostat receives bad data. It thinks the pressure is lower than it actually is, so it keeps pushing it higher, trying to reach a target it believes has not been met yet. Do you see the problem? Your body is essentially lying to itself. The sensor is broken, the thermostat is overcompensating, and the pressure keeps climbing, completely independently of whatever pill you took this morning. This is why so many people over 60 find themselves on 2, 3, sometimes 4 medications, and still cannot get their numbers under control. The medications are working on the pump and the pipes, but nobody is fixing the thermostat. Nobody is recalibrating the sensors. Until now. Let me be completely honest with you about something. Blood pressure medications are not bad drugs. They save lives. I have seen it with my own eyes, in my own operating room, but they were designed with a specific model of hypertension in mind, and that model is incomplete. Most antihypertensive medications work in one of 3 ways. They slow the heart down, they relax the blood vessel walls, or they reduce fluid volume in the bloodstream. Beta blockers, ACE inhibitors, calcium channel blockers, diuretics. Different mechanisms, but the same fundamental logic. Reduce the output of the pump, widen the pipes, lower the pressure. And for younger patients, or for people in the early stages of hypertension, this approach works reasonably well. The body responds, the numbers come down, and everyone is satisfied. But here is what happens over time, particularly in people over 60 with long-standing hypertension. The brainstem adapts. The RVLM, that command center we talked about, is not passive. It notices that something is working against it, and it compensates. It increases sympathetic nerve activity. It signals the kidneys to retain more sodium. It finds ways around the medication. This is not a conspiracy. This is basic neuroscience. The brain is the most powerful adaptive organ in the human body. When you block one pathway, it finds another. And this is precisely why so many patients need progressively higher doses over the years. The medication is in a constant battle with the brainstem, and the brainstem is very, very good at winning. So what is the solution? Do we simply keep raising the dose forever? Add a 5th medication? A 6th? In my experience, no. The solution is to stop fighting the thermostat and start resetting it. Here is something that genuinely excites me as a physician, and I do not say that lightly. After 30 years, very few things still surprise me. Over the past 2 decades, research in neurophysiology has revealed something remarkable. The autonomic nervous system, the part of your nervous system that controls heart rate, blood pressure, and blood vessel tone, is not fixed. It is trainable. It responds to specific physical inputs in very predictable, very measurable ways. Your autonomic nervous system has 2 main branches. You have probably heard of them. The sympathetic branch, the accelerator. Fight or flight. It raises your heart rate, tightens your vessels, drives your pressure up. And the parasympathetic branch, the brake. Rest and digest. It slows things down, opens the vessels, brings the pressure back toward normal. In people with chronic hypertension, especially those over 60, the balance between these 2 systems has shifted. The accelerator is pressed down too far, the brake is weak, and the thermostat in the brainstem has recalibrated itself around this imbalance. Now here is the crucial insight. There are specific, targeted physical techniques that can directly activate the parasympathetic brake. Not gradually, over months of meditation. Not vaguely, through general relaxation, but precisely, through specific nerve pathways, in a matter of seconds or minutes. These techniques work by exploiting the way the nervous system is wired. They send signals directly to the brainstem through pathways that bypass conscious control. The brainstem receives these signals, processes them, and responds by reducing sympathetic output, lowering adrenaline, relaxing the vessel walls and allowing the pressure to drop. Two of these techniques have now accumulated serious clinical evidence behind them. Randomized controlled trials, peer-reviewed research, not folk medicine, neuroscience, and they require nothing more than your own two hands. Let me show you exactly how they work. Block 5. Technique 1. The emergency break. The Hegu point, approximately 300 words. Block 6. Technique 2. The thermostat reset. Isometric. Grip protocol, around the 450 words. Block 7. The 8-week program. How to stack both techniques, around the 250 words. Remember, обращение на вы, max 70. Words per speech segment. Dr. Kevin Adewale. Voice. Authoritative, warm. Personal stories from practice. I want you to look at your left hand for a moment. Find the soft, fleshy web between your thumb and your index finger. That fold of skin, that small triangle of tissue, it has a name in traditional Chinese medicine, the Hegu point. Acupuncture practitioners have been pressing it for over 2,000 years. And now, modern neuroscience has finally explained why it works. That area is richly innervated, meaning it is packed with nerve endings that connect directly to pathways running up into the brainstem. When you apply firm, sustained pressure to this point, those nerve fibers send a signal upward. The brainstem receives it, and in response, it triggers the release of the body's natural opioids, endorphins and enkephalins, which directly suppress sympathetic nervous system activity. The result? Adrenaline drops, blood vessel walls relax, and your pressure comes down, measurably within minutes. Clinical studies have shown reductions of 8 to 15 millimeters of mercury from a single application. That is comparable to a small dose of medication. Not a replacement for your prescription, but a genuine physiological response. Here is exactly how to do it. Take your right hand and grip the web of your left hand firmly, between your thumb and the side of your index finger. Apply strong, steady pressure, not painful, but firm. Hold it for 30 seconds. Breathe normally throughout. Then release slowly. You may feel a mild ache or a warm spreading sensation. That is completely normal. That is the nerve pathway activating. Use this technique the moment you feel a spike coming. Dizziness, a pressure headache behind the eyes, that familiar heaviness in the chest. This is your emergency break. It will not solve the underlying problem, but it can bring you back from the edge while you work on the deeper fix. Which brings us to technique 2. This one requires a little more time, 12 minutes to be precise, but the science behind it is extraordinary, and the long-term results are unlike anything a pill alone can achieve. It is called isometric hand grip training. And before you think this sounds like something from a gym program for 25-year-olds, stay with me, because this was specifically studied in older adults with resistant hypertension. People very much like the patients I see every week. Here's what you need: a soft towel rolled up tightly, or a rubber grip strengthener if you have one. That is it, nothing else. The protocol is simple. Squeeze the towel with one hand, using approximately 30% of your maximum strength. Not your hardest, not gentle. About a third of your full effort. Hold the squeeze for 30 seconds. Then release completely and rest for 30 seconds. That is one cycle. You will complete 4 cycles per hand, 2 hands total, with 30 seconds on, 30 seconds off throughout. The entire session takes approximately 12 minutes. Now, one rule that is absolutely non-negotiable: do not hold your breath while squeezing. I cannot stress this enough. Breath holding during exertion creates what is called a Valsalva response. It causes a sharp, sudden spike in intrathoracic pressure that can drive your blood pressure dangerously high in a matter of seconds. Breathe steadily and continuously throughout every squeeze. In through the nose, out through the mouth. Slow and controlled. So, why does this work? During each squeeze, your muscles are working under mild oxygen restriction. The muscle tissue is being stressed, gently, safely, and it is signaling for more blood flow. The moment you release, there is a sudden rush of blood back into the tissues. This is called reactive hyperemia. And that rush of blood does something remarkable. It causes the inner lining of your blood vessels, the endothelium, to produce nitric oxide. And nitric oxide is one of the most powerful natural vasodilators in the human body. It relaxes vessel walls, not just locally in the hand, systemically, throughout the entire cardiovascular system. But here is the part that truly matters for the long term. Regular production of nitric oxide through this protocol gradually recalibrates the baroreceptors we talked about earlier. The stiff sensors in your arterial walls begin to respond more accurately again. And as they send better signals to the brainstem, the thermostat begins to reset, slowly, over weeks, but measurably, verifiably, sustainably. Clinical trials have demonstrated average reductions of 10 to 15 millimeters of mercury in systolic pressure after 8 weeks of twice-daily practice. In some participants, significantly more. This is not a miracle. This is basic vascular physiology. Your body has the tools. You simply need to activate them correctly. Now let me give you a practical framework, because knowledge without a plan rarely changes anything. Here is what I recommend to my patients. Every morning, within 30 minutes of waking, perform the 12-minute isometric grip protocol. Before coffee, before breakfast, before checking your phone. Sit comfortably, breathe calmly, and complete your 4 cycles per hand. Then check your pressure and write the number down. A simple notebook works perfectly. Every evening, approximately 1 hour before sleep, repeat the protocol. This is particularly important because blood pressure naturally rises in the late afternoon and early evening. The evening session directly targets that pattern. Keep the Hegu technique available throughout the day. If you feel a spike, use it immediately. It takes 30 seconds and can be done anywhere. In a chair, in a waiting room, in a car. For the first 2 weeks, do not expect dramatic results. The body needs time to begin producing consistent nitric oxide responses. Most of my patients began noticing meaningful changes between weeks 3 and 4. By week 8, the results in the studies are clear and consistent. One important note: do not adjust or discontinue any medication without speaking with your doctor first. These techniques work alongside your prescription, not instead of it. The goal, over time, may be to discuss with your physician whether a dose reduction becomes appropriate. But that conversation happens with supervision, not unilaterally. What changes week by week? In weeks 1 and 2, consistency is the only goal. In weeks 3 and 4, you will likely notice less variability in your morning readings. By weeks 5 and 6, the evening spikes begin to flatten. And by weeks 7 and 8, many patients see their baseline numbers shifting downward in a way that feels genuinely different from medication alone. Because it is different. You are not suppressing the thermostat. You are teaching it to reset. I want to tell you what happened to that 72-year-old man, the one who sat in my office and asked if he was broken. I taught him exactly what I have just taught you: the morning and evening protocol, the emergency technique, the notebook. He came back 8 weeks later. His morning reading, 128/82, down from 165, on the same medications. Not a single dose changed. He looked at me across the desk and he was quiet for a long moment. Then he said, "So my body actually knows how to do this. It just needed reminding." That is exactly right. That is precisely right. Here is what I need you to truly understand. Your body is not your enemy. It is not failing you out of stubbornness. It has been working with incomplete information. Stiff sensors sending bad data to an exhausted thermostat that has been stuck on high alert for years, possibly decades. What these techniques do is restore communication. They send clear, reliable signals back through the nervous system. They give the brainstem accurate information, and the brainstem, given accurate information, responds rationally. It begins to let go. Now here is the fact that I find most remarkable of all. A large-scale meta-analysis published in the British Journal of Sports Medicine reviewed dozens of trials on isometric training and blood pressure. The conclusion was striking. Isometric hand grip exercise produced greater reductions in systolic blood pressure than aerobic exercise, dietary changes, and in some comparisons, certain classes of medication. Read that again. Your own hands? 12 minutes, twice a day. This is not alternative medicine. This is published, peer-reviewed cardiovascular science. And the fact that most people sitting in a doctor's waiting room have never heard of it, that genuinely troubles me. because you deserve this information. You have deserved it for years. The thermostat can be reset, the sensors can be retrained, and you have everything you need to begin, right now, today, in the chair where you are sitting. Let me leave you with 3 things to remember from today. First, high blood pressure after 60 is very often a thermostat problem, not a pump problem. The brainstem control center gets stuck on high. Medications treat the downstream consequences. These techniques address the source. Second, you have 2 tools now. The Hegu point for immediate relief during a spike. 30 seconds. Your left hand, firm, steady pressure. And the isometric grip protocol for long-term recalibration. 12 minutes, twice daily, 8 weeks for meaningful results. Do not hold your breath. Ever. Third, write your numbers down. Every morning, every evening. Progress that is not measured is progress that disappears. I want to ask you something before you go. Have you ever been told by a doctor that your body could help regulate its own pressure without changing your prescription? Leave your answer in the comments below. I read every single one. If this video gave you something useful, please share it with someone you care about. Someone who has been fighting this battle quietly for years. They deserve to know this too. Take care of yourselves, stay consistent, and please, before making any changes to your health routine, speak with your own physician first. Everything I have shared today is general medical information based on current research. Your individual situation is unique, and your doctor knows your full history. Work with them, not around them.